So let's do a little polling now. If you can get your mobile app out and answer the questions. There's 8 questions, and I'll let you read those. Using telehealth technology in nursing practice is within the scope of nursing, and on down. So I'm going to give you guys a couple minutes to answer these questions. Is anybody, and then after that we'll ask if anybody has any questions they want to ask Mindy or Beth. Yes. Can I throw you a mic? I used to play softball. I don't want to embarrass myself.
So I'm curious on the qualifications of the safety officers, especially dealing with hazmat suits and what type of background they had. Or was it just an extra set of eyes?
So, do I need to stand back up, or is this good? We had a fairly extensive educational program with all the people it was a very quick, rapidly developed educational program that we developed an instant action plan that looked at how they donned off PPE safely and how they the plan of care. So there were certain aspects to plan of care, lots of work on how they managed the waste, how they managed the blood specimens. And we simulated these so no one went into the room without having gone through the training, and it was they also served as safety officer. So they had an increased knowledge related to this. We didn't just let anybody sit at the seat. We wanted someone who'd also had trained, and they would rotate. So they may be in the room for 2 to 4 hours, then they would be at the desk, and then they had a rotation that went through.
Thank you.
You're welcome.
Anyone else have some questions on the app? Yeah, questions on the app or thank you. Okay, very good. Can you put the polling questions up? Thank you. Okay. So using telehealth technology in nursing practices within the scope of practice of nursing. So I've got a few stragglers there. Okay, so obviously most people agree with that. Some people do not. Of the people who do not agree with that, do you have any comments about why you don't think that nursing telehealth is within the scope of practice of nursing? Go ahead. We're not going to be mad at you or anything.
They mostly agree.
I think they agree, actually.
Just somewhat.
Right, but there's some who don't. Oh, that is an agreement. I'm sorry. I thought that was the strongly disagree. Sorry, my error. Okay, good. All right, let's go to the next question. Nurses are comfortable integrating telehealth into nursing practice. There are some disagreeing there, and I will have to say that is true in my experience as well. Does anybody have any comments about the difficulty in integrating telehealth in nursing practice, or some of the barriers that you're encountering? Mindy, what kind of barriers did your program encounter with the VIC program?
I think the first barrier that we recognized was that this was an extra step nursing had to do to set up the equipment in the room and facilitate the call. So initially they were a little bit put out of having to have an added task to their already filled day or their already filled task list. But once we did implement it, they realized it was a quick, easy way to have the doctor in the room with the patient. And they really did embrace it, and now I don't think they could imagine life without it. But it was getting that initial buy-in from the staff and teaching them, making it a simple process to work with, and making it and teaching them correctly so that they were comfortable right from the start.
I agree with that. Over at the University of Virginia, I would say that most nurses are not comfortable integrating telehealth into practice. There are some nurses who don't even know what telehealth is, unfortunately. I teach in the nursing residency program. Before I always ask, have anybody heard of telehealth? Have you heard the word? Do you know what it means? Have you ever seen it in practice? And a few people raise their hands. Oh, I saw it when I was a nursing student at this hospital or that hospital. And most people say, well, I've heard it, but I don't really know what it is. I mean, these are our new graduates. Do not know what telehealth is, so that's sort of concerning. Okay, next question. Okay, I think everybody's agreeing on that. Effective nursing communication skills are vital to leveraging telehealth into nursing practice, and that's what we're trying to focus on here today. The role of nursing and telehealth do go together, and we do need to make sure that all nurses have the skills, knowledge, and collective experiences to make that happen. Okay, next. Okay, we got a few neutral people here. Nurses should gain telehealth knowledge and skills and training to lead in professional teams of stakeholders to develop telehealth projects. You know, nurses are the largest workforce in healthcare, and we are also the largest national workforce. And so we have that special contact with patients, we have that special relationship and that trust with them. And so we really do need the skills and the knowledge to be able to lead these telehealth programs. Okay, next. Okay, I think everybody's in pretty much in agreement there. Nurses should be able to enable safe and accurate patient assessments and care delivery using telehealth technology. And the demonstrations today in these projects show that that is absolutely true. Very good. Okay, next. There is an important role for nursing delivering patient care and telehealth. Absolutely. Again, we are really on the forefront of telehealth, of nursing care, and all we have to do is learn about it and have that aha experience, and so then we can get confident and creative in applying it to practice. Very good. Next, please. Okay. Nurses should gain telehealth knowledge and skills to combine clinical care with technology. Okay, very good. So we're all in agreement, and I think most nursing schools also recognize the need for incorporating telehealth education into their programs, although that is a little bit slow in coming. I will say that our colleagues at ODU are doing a really great job. That's Old Dominion University in Norfolk. They're doing a really great job of integrating telehealth into their curriculum in a variety of levels. So I hope schools in your area are also doing that. Okay, next. Telehealth should be used to support nurses in the delivery of nursing care. You can see that we are talking about technology being able to help in delivery of care and the delivery of nursing care as well. And this is just a speck of the innovative and creative projects that nurses can be involved in using telehealth. Okay. Take a few minutes now, or just a minute now, and answer the last 8 polling questions. And while you all are doing that, I would like to ask some of the nurses who are using telehealth in practice. So, what are the role of what is your nursing role in your program, and what skills do you bring to the table as a nurse that are readily transferable to the telehealth project, like Beth's project in assessing the patient? They can watch using video conferencing, the nurse assessing the patient, that kind of thing. And so that seems pretty easy and pretty comfortable. But what about the other skills that nurses bring, the therapeutic nurse relationship, empathy? How do you do that through telehealth? Does anybody who is involved in a program want to speak to that? Come on. Tina, how do your students feel about providing that therapeutic nurse relationship and demonstrating empathy through the screen? Do they feel like that is actually something that's possible?
Well, interesting you should ask. There's a poster out there. And initially they don't. And it's surprising. I mean, we are a group of people that believe in telehealth, and it's fascinating to find that our digital natives who are in the age that have been using FaceTime and whatnot, when we put them in a telehealth experience and it's their first time doing it, they have real angst that they are not able to display empathy. And on the flip side of that, we use standardized patients, and our standardized patients are scoring that, or are scoring their degree of empathy. So when the standardized patient comes in and meets with our interprofessional team of students, which are nursing, physicians, social work, physical therapy, whatnot, there's 7 interprofessional team members, the student always says, no, I didn't think I could do that. I was doing a bad job. How do you express empathy through the screen? And the standardized patient says, but you did. So then we start talking about the techniques that they use that they didn't even realize they were using. You know, leaning in, nodding, making direct eye contact, looking at the camera and not at the screen. Some real simple techniques.
Very good, thank you. Can we put the, anybody have any questions or comments on that? Let's put the polling questions up and we'll finish up. Okay, very good. So I'll just read these through. Look like we have some agreement there. Nurses should provide health promotion through patient, family, and caregiver support using telehealth. We had some good demonstrations of that with Christy's project and with Allison's project. Thank you. Okay. Therapeutic nurse-patient family caregiver relationship can be fostered using telehealth, and that's also been demonstrated here today. Does anyone else have any projects using caregivers or have any ideas now where you can sort of go with those projects? Very good. Okay. Empathy and the human factor in nursing care can be delivered using telehealth. There's that little 6.5% there. Yes. Well, you know, as nurses, we give that same sort of care through face-to-face as we can through the video conferencing. And as Tina said, you're looking at the patient and you're sort of, you know, leaning in, you're sort of nodding, you're, you know, giving them your full attention, letting them know that you're understanding and you're hearing what they're saying. And that's really the basis for that. Okay, next. Nurses can deliver private and confidential care using telehealth. In some of the projects we showed you today, they did not use HIPAA-compliant systems, but that was because there was no patient information actually being transmitted, and both parties agreed. But certainly, when using telehealth for care delivery, we make sure we are using HIPAA-compliant systems. So that's probably what that neutral there is. Does anybody have any comments? Yes? Well, I was actually thinking about HIPAA compliant, but also the confidential and private nature of you know, telehealth visits can also be entertained there. And you know, telepsychiatry has been being used. Telepsychiatry has been up and running for a long time now, and so that's very comfortable for patients to sit in their own environment and they feel, you know, private, and they feel like the conversations they're having with their provider is confidential. So that's certainly something to think about. Yes?
I just had a comment to that. I think what's important is that you set up the environment, the environment on both ends, a video screen, so that the person knows that you're in a closed room and no one's going to walk in and no one is going to interfere with their interaction with them. And you want to know where they are and who possibly is in the environment for them. And that's one of the things you set up before you get into the confidential information.
Very good. Very good. Privacy of the environment. Very good. Thank you. Okay, next. Nurses should gain skills to use telehealth and promote health for families, patients, and caregivers. Again, I know this is sort of a skewed audience, but you'd be surprised at the answers to that when people do not really, you know, understand telehealth. Okay, next. Providing education to patients, families, and caregivers via technology is a practice nurses should engage in. And I think there's been strong comments today already about the number of caregivers that we use to provide care for our patients in this country. And so I think that's something we should further explore. Okay. Leveraging telehealth technology with nursing expertise to enhance and provide healthcare education and support is within the nursing realm. So we have some that strongly disagree on that. We have the majority, of course, that agree or strongly agree with that. Can anyone speak to the issues with this question about the disagree or the strongly disagree answer? Does anyone give any insight about why you're feeling that way? No, nobody wants to be singled out? It's okay. It's really okay. This is something that we are working on, of course, to get technology into the didactic and the curriculum for nurses. So we will be working on that as we go forward. Okay, is there any more? Is that the last one? Okay, nurses have an important role in the integration of telehealth technology to improve patient care outcomes, and I think we're all in agreement with that. Okay, I think it's the last one. Okay, great. Okay, we have a couple questions here. We might have a minute or two to answer those. Okay, when using VIC for post-op visit, what solutions are there for observing a wound that may be hard to access, or if there is a need to something around the surgical site. Sorry, I can't just see that. Okay, Mindy, you want to answer that?
Sure. So when using Vic, and we teach the doctors and the providers that are using him, if there is something you're seeing that you're just not comfortable with, then you need to go see the patient live. It's not a substitution if you're not sure. So if there's a palpation involved, if it's a questionable surgical site, they can use the Vic, they can take control of the camera, they can zoom in on the surgical site, but if they look at that and they feel it's just not something they're comfortable making that decision remotely, then the patient stays and they come and see them on their rounds.
There's a couple questions here for you. How many patients receive the virtual check-in, check-out? Is it given to all patients? Do the visits occur at scheduled times? I think that you had used it for mainly your bariatric patients, but can you address this?
Yeah, we started initially with the pilot program, which we're getting ready to expand at this point. So right now it's all our bariatric patients that have surgery, and it's available to every one of them. Even if they're not ready for surgery, the surgeon still likes the idea that he can Vic into the room and have a conversation with them, explain to them why they're not quite ready to go home, or if they're experiencing complications, what they can expect, if it's nausea, vomiting, when they can expect that to resolve. And I think the patients like that. They're actually getting to see their surgeon, which wasn't always happening. It was always a physician extender, or they were seeing them late in the day. And they're in the midst of a complication, they get to see their surgeon at that moment. So I think it's really, we've seen some hidden benefits that we didn't anticipate when we were first exploring the program.
And that's interesting because that's what Beth also mentioned, that the sort of interesting things that came out once you actually start using the program. And I guess it's the question about who is bringing the unit into the patient room. So how do they actually connect to the physicians using the video conferencing?
That's another great question. It's something we took our time in deciding because, again, we didn't want to overtask the nurses. A nurse might be in the middle of an IV stick or a lab draw or a medication pass when the surgeon was ready. So the surgeon, we have it all set up. He has a number he calls, and it's the unit secretary. And when we implemented our electronic health record, that took away a lot of the responsibilities that the unit clerk had previously had done. So we were kind of looking at a role evolvement for those folks, an evolution, and Vic was one of the means because they're in control of the bedboard. They know who's coming, who's going, who's potentially going. So we gave them this responsibility, and they took it and they ran with it. So when they have a patient, after the resident sees them, they'll go and report out to the unit secretary and say, so-and-so in room whatever's ready to go. They'll place a page to the surgeon. And then when they come out of the OR, they'll see their page, that patient's ready to go. They'll place a call, and the unit secretary goes in, turns on the Vic, and waits there and helps to answer the call for the patient. They explain who all's in the room, so the surgeon knows who they're talking to. They close the door to ensure privacy, and they're kind of like the point person for the project. And that way we weren't pulling nurses off their tasks, and we were giving a new role, a well-embraced role to another member of the care team.
Very good, thank you. Any other questions? Okay, thank you very much. Appreciate your attendance.